This is the tennis module. Frequently, we see lateral epicondylitis involved with individuals playing tennis, or called tennis elbow, which is an inflammation of the tendons attaching to the outside aspect of the elbow. The exercises in this module are designed to improve power, strength, endurance, and flexibility, all of which will help prevent this injury from occurring, as well as improve performance on the tennis court. We will begin with some stretches. First, the wrist flexion stretch. The subject takes the opposite hand and pulls the wrist downwards towards the floor to stretch the extensors of the wrist. Next, the wrist extension stretch. The palm now faces the ceiling, and again the hand is pulled downwards to provide a stretch to the flexors of the wrist. Next, we'll look at strengthening of the most important muscles in tennis. This is a wrist extension strengthening exercise. The palm faces the floor, and the wrist is moved upwards towards the ceiling, against the resistance of the weight. Next, we'll look at wrist flexion. Now the palm faces the ceiling, and again the wrist is curled upwards towards the ceiling. This should be done in isolation at the wrist joint alone. Next, we'll look at radial deviation strengthening. The thumb facing the ceiling, the forearm in a neutral position, and the wrist curling upwards. The next exercise will mimic a backhand in tennis, against the resistance of the band. You can see the subject pull down and out. The next exercise will mimic a forehand in tennis, with the subject starting down and out and pulling up and in across the chest. For the tennis module, all of the strengthening exercises should be performed with the 50 technique. This technique combines power, strength, and endurance, using both high repetitions and low repetitions in order. Each set is performed at each repetition level, the first set being at 50 with a rest, then 40 repetitions and a rest, 30 and a rest, 20 and a rest, and then 10 and a rest. Following the completion of this progression, the subject should move to the next exercise. Again, with the high repetition numbers, the weight should be lower, and with the low repetition numbers, the weight should be heavier. This should be performed twice a week.